Hello and welcome. Today I am joined by Dr Zaf Iqbal, who is an SEM consultant and also head of sports medicine at Crystal Palace Football Club. So Zaf, thank you for joining.
Thank you for inviting me, Andy.
No problem. So whereabouts are you at the moment?
So at the moment, we're just in the hotel. So we've got an away game against Wolves tonight. So we came here last night. So the lads have just had their lunch, so they're resting up, and so this just gives me an opportunity to catch up on paperwork and have this meeting.
Right, very good. So what normally happens then on like a game day? When did you arrive in Wolverhampton area?
Yeah. So all away games, we tend to stay in a hotel, even if it's an away, evening game. The reason being is you've got to make sure that the lads get a good day's rest and that we're able to get here in good time. So even if it's a London game, again, we'll stay in a hotel overnight if it's an away game. So we got here last night about 7 o'clock, got up here on train, and then the manager will have a meeting. We'll have our evening meal together, and then this morning, breakfast, lunch. Manager will have another meeting, and we'll have our pre-match meal about 3 hours before kickoff, and so our kickoff's at 7:30.
Right. And then do you stay over tonight as well, or do you head straight back?
No, we'll be going straight back. So hopefully we've got tomorrow off. So we'll be heading straight back. So there's a coach that goes straight back. It's a late one, but yeah, at least we'll be able to get back to our own beds.
Yeah, no, very much so. And as we said before, there's no easy games or small games at the moment. So good luck with the rest of the running on that.
Cheers. Thanks very much. Thank you.
So, and then in terms of you then, so whereabouts are you from originally?
So I was brought up in Rochdale, just outside Manchester. So although my parents are originally from Pakistan, I was born in Pakistan, but I came over to the UK when I was 2 months old. So I've lived in the UK practically all my life, and the majority of my time was in Rochdale until I went off to university. And so you probably sense I've still got a little bit of a northern accent. And when I get a little bit excited, that comes out even stronger.
Right, yeah, well, yeah, we're just in central Manchester, so very close to Rochdale itself. And so, when you were starting to look at deciding what you wanted to do, what prompted the move into medicine? Like, what were the motives for that?
Well, it was quite a personal tragedy, unfortunately. So I had a sister who, when I was 10 years old, unfortunately, she was 3 at the time and had got brain cancer. So before that, my dad, he really insisted that we made sure that we got a good education. Unfortunately, he didn't. Both my mum and my dad were labourers. My dad was a bus driver. Mum had a corner shop, and so they really wanted to make sure that all their children had a decent education. So he really stressed the point that I should be as at that time most South Asian parents, is either a doctor, dentist, or engineer or chartered accountant. And so I hadn't made my mind up, but I really wanted to go down some sort of education field. But I think my pathway was decided when my sister, as I mentioned, had brain cancer, which was diagnosed when she was 3 years old. I was 10 at the time. And over the next 6 years of her life, I suppose seeing the care that she received in hospital, that's what really inspired me in terms of going down the medical route.
Right, and so, like, at what point did you start to plan for that then? Was you GCSEs, A levels, and so on?
So from the age of 10, I was determined. So the teachers were quite stunned when I said from the age of 10, I was like, no, whatever happens, I'm going to become a doctor. So I was really determined to be a doctor at that time, and right up to the age of before I got into medical school, I wanted to go into neurosurgery, and that was prompted by what had happened to my sister. So but I knew the first thing was really getting into medical school. So I was doing everything possible to make sure that I had the best opportunity to get into medical school. And so it was just making sure you could get the best grades possible.
Well, yeah, no, that is young in terms of deciding that then. And so for that, do you ever deviate from that plan, or was that all the way through?
No, I was determined. I think once I'd set my mind to it, I was determined to be a doctor, and as I said, at that time, uh, my only real exposure had been the care that I'd seen my sister receive, and probably the odd time that I'd gone with my parents to the GP. But as I said, I'd got it set in my head from the age of 10 that I wanted to be a doctor and wanted to help other people, like those that helped my sister.
Yeah. And then, so when you were picking medical schools to go to, how did that come about? How did you pick where you wanted to go?
Well, it was quite tough because at that time, getting into medical school, and also I didn't really have uh, people guiding me. So I had the school um, careers advisor, but really, again, wasn't really that helpful. So it was very tough. I just had to make sure I got the best grades possible. And I didn't straight away get into medical school, my first choice. So I'd got an offer from Liverpool Medical School, and I didn't get into there. And I went to Leeds University, did medical sciences there. And so then what happened was that I did well at Leeds, and I was able to transfer onto the clinical studies at St Bartholomew's in Royal London. So I'd only managed to get three Bs in my A levels, and the offer that was given was an A and two Bs. So as I said, when I got to Leeds, I was still determined that I was going to become a doctor, and so I studied and worked hard. BSc. I did well in that, and then I got interviewed at Barts in the London to transfer directly onto the clinical studies there. And I must have done something right in the interview there, and they offered me a place, and I completed my medical degree at St Bartholomew's in Royal London, which I finished in '99.
Right. So when you go on these interviews then, so what do you think they're looking for beyond, obviously, they've got your academic achievements? What are the things they're asking you?
I think your motivation, why you actually want to go into medicine, they're probably looking for the qualities that a doctor should have in terms of being empathetic, good communicator, continually wanting to learn, and being a caring person. So I think those are the key questions that they sort of ask, and you've got to try and give examples of that, and anything in your life that has shaped that, and where you can give it your own experiences in terms of the qualities that they're looking for that you've got, and giving examples of that, really.
Mm. And then, so when you got to medical school, then you were working through there, did you start to formulate from the experience you were having which areas were more of interest? You'd looked at the neuro bit, but how did that come about?
Yeah, so we had very limited exposure to neurology and neurosurgery at that time going through medical school. But I quite quickly then decided that probably wasn't going to be the career for me, more because I felt I was going to be too emotionally attached. And so I then decided that from a very young age, I was very good at fixing things. My dad, whenever we had school holidays, he'd always have me around the house instead of while all the other kids were out playing, I'd be doing odd jobs around the house. Any DIY he'd have me doing, and this, as I said, was from a very young age. And if there was nothing left in the house to do, he'd offer me to other people in the street if they've got any odd jobs. And he'd volunteer me to do that. So I wouldn't get any money for it. He'd just offer me to people in the street, to help out. But I was always good at fixing things from a very young age, and I quite like the idea of orthopedics. So I did a couple of weeks attachment with orthopedics. I like the fact that you're able to help a wide variety of people from different backgrounds, not necessarily with severe comorbidities, but people who'd suddenly had a quite drastic change in their life. So somebody who could be playing sport, somebody who even is not playing sport, and they break the leg or they fall and get an injury, and then being able to help them return back to what they were doing before, quite appealed to me. And the other bonus point is that you can have quite quick fixes in orthopedics as well. So that was the area that quite interested me. And so once I'd completed my medical degree, I was thinking of going down the orthopedic A&E and all the rotations that are required for orthopedics. But then my career pathway took another change because I used to love playing football, and while playing football, I got a knee injury, so I managed to do my ACL. And at that time, this was back in 2002, even though I was a doctor at the time, when I went to see one of my colleagues, I was told that it was going to be 18 months before I could get an MRI scan. So I started the conservative management of physiotherapy. So I did that for 6-7 months. And I was quite, here I am. Suddenly I've got an injury, and it was very, I then started medicine, and I did a master's in 2004 at Queen Mary's, just trying to find out a little bit more about sports medicine, not only to try and help myself, but then hopefully in the future try and help others as well. And so from then on, I decided that I wanted to go down the sports medicine route.
And then for that as a profession, then what were the opportunities around about that time in sports medicine?
Well, they were very limited because sports medicine as a speciality wasn't officially recognized till a few years later. I think it was 2006. So that was when London had won the Olympic bid for 2012. And as part of that bid, it was proposed that there would be a certain number of sports medicine specialists, and that it would be recognized as a specialty in its own right. So prior to that, there were probably jobs at football clubs, but it's quite variable in terms of your responsibilities at the clubs. They were mainly run at that time by physiotherapists, and the doctor's role was really probably just going in for match days and just doing the primary care stuff. And it probably wasn't until a little bit later on that's really when sports medicine started to take off and be recognized as a specialty. So I'd gone into it quite blind, in the sense that I wasn't sure what kind of pathway it was going to lead me down. All I knew was that I was interested in sports medicine. I had a passion for it and wanted to learn and try and, even within the NHS, try and improve sports medicine for others. So I started setting up NHS sports medicine clinics, and really the main purpose of it was not only to try and educate myself and learn a little bit more, but it was really to try and help others. So I used to play in Sunday league teams in London, and so I know there were lots of players there who would get injured and they just literally go to A&E or their GP, and they would just be offered some anti-inflammatories and get your GP to refer you to physiotherapy. So what I did was, through A&E, I set up an NHS service by which that they could refer from A&E directly to the sports medicine clinic. And the plan for that was to help come up with a better diagnosis, or a more specific diagnosis, and then start the initial rehab management. So even if that was just giving them some basic exercises, or we also had physiotherapists within the clinic refer them to the physiotherapist so they can start the rehabilitation and return back to sport much quicker.
And so how easy is it setting something up like that in the NHS then? You made it sound really easy, but it doesn't, I can't imagine it would be that quick a process.
No, it isn't. And I was quite lucky where I did my sports medicine masters at Queen Mary's. They already had a sports medicine clinic set up there, but it was voluntary in the sense that you weren't paid, but it was an opportunity to gain experience, but also try and help set up a service. So the fact is that you know, it gave me an opportunity to actually try and make contacts within A&E, and also, just as I said, to set processes for myself in terms of how we got the patient being seen in A&E, being transferred directly and referred to the sports medicine clinic, and then you being able to see them. So the whole plan was within 3 days of them getting the injury or being seen in A&E, they should be able to be seen in the sports medicine clinic, because as we know, the first week or the first day really of anyone getting an injury, it's really important that is managed correctly, because otherwise it can then quite quickly become a chronic problem.
And so how was that received then, both by the people coming through, but also just like the medical team and the clinical team that were involved?
So it was good in the sense that the A&E liked it, because it meant that they could quickly refer allowed an MSK problem and was playing sports. It gave them an opportunity to quickly refer out. So they would do the initial investigation, make sure it wasn't anybody that needed any intervention immediately, i.e. by orthopedics. If it wasn't, if it was a soft tissue injury, then it was referred to the sports medicine clinic. So they were grateful for that. The hospital itself, where I was working, the sports medicine clinic, they must have also got some funding because of the fact that they're seeing a certain number of patients. So I'm sure that they were also grateful for that. And then we also got very good feedback from patients. Quite quickly, we found that we were getting patients from all around London, because there weren't many sports medicine clinics in the NHS set up. And so then we were unable to complete in terms of the demand that we were getting from the number of patients. And then I also worked alongside Dr. Ian Beasley at medicine clinic set up, and we were given a blank canvas in terms of setting up an NHS sports medicine clinic. So that obviously shaped and helped me a huge amount.
Yeah, no, I can imagine. And then for for your first role in sport itself, then working for a club, how did that come about?
So for 2 years, I was doing lots of voluntary work, and so starting out in sports medicine was difficult because there wasn't a set pathway. So wherever there was an opportunity to do any sort of voluntary work, I jumped at the chance. So there were local non-league clubs. So when they'd have major games, I'd hear through the grapevine things like the London, where they wanted doctors, mainly for the crowd. But as I said, when I went along, I'd also meet with the physios that were dealing with athletes as well, and just make the connections through that. So 2 years I was doing lots of voluntary work, and then my first real opportunity came at Leyton Orient. So I was actually it was two roles. So one at Leyton Orient, where the doctor was leaving to join England Rugby. And so initially I'd done some voluntary work there, and then he asked if I wanted to be the first team doctor. So I jumped at the chance of that. I mean, again, it wasn't a massive role. It was literally covering match days. But then I also took it upon myself to go in at least once a week, unpaid, but that was really just to review the players, and it was for my own experience. And so again, I had some good colleagues there, Dave Appenar, who's now at Tottenham. So that was my real first role. And then there were also the opportunity to work with England youth teams, mainly the under 15, under 17 women's teams at the England FA. And so that was doing camps where they would play around Europe. And so just being the tournament doctor for the team for the camps. And so that again just allowed me some exposure in sports medicine and team medicine. And then from there, at the same time while I was at Leyton Orient, I was also approached by Alistair Rattray, who had been involved with something called the FA Medical Society. And so this was an educational society where they'd organize conferences for other doctors and physios. And at that time, again, as I was starting out, I'd found it really difficult to know who the best people to refer to, who the best people to seek advice from, sports medicine is obviously a very different specialty to other much more recognized and established specialties. So, for example, if you look at cardiology, if somebody comes into the hospital with, having had chest pain, there's a set management plan for that patient, no matter which hospital to you go to. However, if somebody has groin pain, if somebody has a hamstring strain, depending on who you see, different people will manage it in different ways. So it was difficult for me to when I first started out to actually go, what is the right way of managing the different problems that I'm facing with. So when he approached me and said, look, I've heard you're interested in education. He was a secretary for the FA Medical Society. Would I be interested in organizing these sports medicine meetings? I said, yeah, why not? And that's probably one of the best things I'd done, whereby 4 times a year, and as I said, I've been doing it since 2006. It gave me the opportunity to organize meetings for other doctors and physios in the UK on problems initially that I found difficult to manage. And then what I would do is seek the best speakers that I could find and get them to present. And then what that did, it helped me not only make good contact, but also learn directly from the specialist and see if it made sense to me. And also, it was an opportunity for other doctors and physios to ask similar sort of questions that I was also asking as well. And I'd say that's probably the thing that I did, which I really enjoyed most. And as we're still doing that now, so I've got 3 other doctors now help me with that. Dr. Imtiaz, Andrew Shafiq, and Sean Kamodi. And so we between us organise 4 meetings a year. And as I said, they're well attended, and we've had some unbelievable speakers, and we've been fortunate to be able to invite speakers from around Europe as well.
Right. So how do you pull out the different bits of information then? If it was based on what you wanted before, I'm sure there'll be a lot of different insights.
Yeah, so I think the first thing was it was problems that I was facing while I was working at Leyton Orient. So there was a player who had a groin issue, and we saw 3 different specialists, and all 3 specialists recommended surgery. But what was interesting was that it was completely different types of surgery. So even though it was the same supposed symptoms, they were proposing completely different types of surgery. And I just found that very interesting, whereby most people will just take the player to one surgeon or one specialist, and that specialist will say, this is the treatment. Once the player's heard that, then it makes it very difficult unless you've got an alternative for you not to go with that treatment, because that's what the specialist or the surgeon is saying. You've got to have this. And what I found over the years that, especially with regards to groin surgery, posterior wall defect, whatever you want to call it, is that quite often a player will go to a surgeon, doesn't resolve their problem, and then they still want to fix, and then you'll go to another surgeon, and then they'll do another type of surgery. And early on, I found players, and I'd heard of players that were having 2 or 3 different types of surgery, all for the same problem. So that was quite a big conference I then organized. That was one of the first meetings, and I got together speakers. And it's quite interesting when I organized that conference, the main so-called specialist for hernia surgery, posterior wall defect surgery, they'd never even sat in a room together and debated this. And I was actually a little bit, I wouldn't say sneaky. What I did was I didn't tell each of the speakers who else was attending, because I'd heard that they might not attend. And so when the flyer went out and the 4 speakers were actually on there, I actually got 2 of the speakers said that I'm not speaking if that person is speaking. I said, well, look, we've got over 200 people attending, so I'm afraid that either you're going to have to attend, or I'm just going to have to say that unfortunately you pulled out, and people can make their own mind out as to why you pulled out. So yeah, it was a very interesting meeting. Again, I don't think we got to the bottom of it, in the sense what is the right way to deal with groin surgery, hernias, sportsman's hernia. As I say, there's various terms that are used with regards to that. But Certainly from there, I know there have been other conferences specifically on that area. So it was, as I say, it was certainly useful for me. What I've learned from those meetings is that clearly there's not one way of managing a particular sports uh, related injury or problem. But what really is important is that it's got to make sense, both to me, the physios, and the player, so that it's physiologically it's got to make sense. So whatever you're proposing, whatever treatment it is, it can't be just right. This is a treatment, and nobody really questions it. We see in sports medicine lots of treatments being offered, and you often hear players and agents, who will go and say, "Well, have you tried this treatment? Have you tried horse placenta? Have you tried, this type of injection?" And I've now got quite an open mind. First, as is always the case in medicine, is do no harm. But at the same time, it's got to make physiological sense. We're scientists at the end of the day. It's got to make sense, the rationale behind why you're proposing a particular treatment. If it's not making sense to me, and if there's likely to be harm, then I'm going to be strongly against that. Somebody's got to be able to convince me and the rest of the team that actually this isn't going to do harm. There is going to be some benefit, possibly, but more importantly, it makes sense in terms of why we're actually doing that. And some people may argue, well, what's the harm in terms of a player going abroad if there's no harm in terms of them getting a particular treatment or injection? Well, for me, there is, because every time that player is away from you, then even while they're traveling, that means that they're not getting the right treatment. And at the same time, you're not in control in terms of what exactly is happening to that player and in terms of their load and in terms of their overall rehabilitation management. So I have no issues with regards to players having treatment elsewhere, as long as there's good collaboration, as long as everybody is open and transparent. And as I say, the key for me is that it's got to make sense in terms of what is actually being done to the player.
Yeah, yeah, we've probably seen a lot more of it now with the expansion of the Premier League and so on, with a sort of diverse set of nationalities and so on. Has that changed a lot since you've been involved in football?
Yes. So when I first started at Leyton Orient, and even when I was at Tottenham Hotspurs, which was my next job after Leyton Orient, it was a very small medical team. The core group were based, were clinicians from the UK. But then what has happened is over the years, you've got, because of either the manager being from abroad, but also the fact that, clubs have realized that sports medicine, it probably wasn't as well established here, certainly when I first started. And so they were looking at getting clinicians from other countries where sports medicine had been established for a longer period. So, for example, around Europe and Australia. And so it then led to also the fact that you were getting players from other countries as well who had been exposed to different methodology, treatment methodology to what we provide here. And so as a result, they also wanted similar sort of treatment to what they would get back in their home countries. And you'd also then get an influx of physiotherapists from various European countries as well. And so, as I say, certainly it's been eye-opening in terms of how the same problem can be managed in different ways. But for me, I still go back to it, even if it's a physiotherapist from a different way of working, it's still got to make sense to me in terms of physiologically and the progressions, and the end stage in terms of it's got to make sense in terms of what we're actually doing. And so if there's a physiotherapist who has a different way of working, if they can explain to me and it makes sense and they've got some not only just experience, but they can provide some evidence of why that particular methodology works, then as I say, I'm more than open to it. If you don't provide that, if you don't listen, then the problem that you have is that the player will go and seek it themselves, or they will go and do it secretly. And if they do that, that's obviously the worst outcome, because then you don't know what's going on, and then if a problem does arise, you don't know if it's because of your management or because of the management of someone else.
Yeah, yeah, that makes sense. And then, so Tottenham, how did that role come about?
So I think there was the opportunity to do some games at the academy. And also, I just reached out. So Dr. Charlotte Cowie was the head of sports medicine there. And I just reached out and said that, look, if there are any opportunities to cover games in the academy with the under 18s, I'd be more than happy to help. And so I probably was quite persistent. And eventually, I think she needed someone to cover a game, and I jumped at the chance. And so one of the under 18 games, I covered that. And then Wayne Diesel came in, and at that time there wasn't a academy doctor, and I think he needed someone to do a medical on a player. So he just come in, and the first team doctor was away, so he got in contact with me because one of the other academy doctors had given him my number, and so I did the medical on the player. I met up with Wayne. And then I just told them, look, I'm just doing some occasional work at Tottenham Hotspur. My main work's at Leyton Orient. And then about a month later, they advertised post academy part-time, and so I applied for that, and I got the post, and that's how I got into Tottenham Hotspur.
Right. So yeah, I've done one of these with Wayne. So he's got a lot of interesting tales and worked in a variety of environments. So how does the dynamic work then, in terms of, like you mentioned before, like physios previously would run the departments? Like, has that shifted over the years?
It varies from club to club, and as I say, I don't think there's a right way in terms of or the right person. When I say the right person, whether it should be a doctor or a physio or you know a sports scientist managing the department, because at the end of the day, managing the department, you're managing people, you're leading you know different specialities, and so as I say, I've not had a problem working with uh, different heads of departments, whether they're physiotherapists, sports scientists, or the doctors. As I say, it varies from club to club. Has it changed? It probably has changed in the sense that there may be more um, doctors and sports scientists or head of performance who you know maybe a combination of who've done both physiotherapy and sports science who end up becoming head of departments. Because previously, as I say, I think initially always used to be the physiotherapist because uh, there was always the requirement for a physiotherapist within a football team environment. So it was natural that they headed up the department, and then they pulled in whichever other services, whether it was a masseur or whether it was a doctor. So they pulled those in as and when required. Over time, medical departments have grown massively, certainly over the last 10 years. And so, you know, with the obvious cost of how much it, you know, in terms of the money that's involved and the costs to the club if a player is not playing, then clubs have realized the importance of having a good sports medicine and science team and investing in that because it's important to get players back as quickly as possible. So medical teams have expanded. You know, you'll find quite often there will be um, anything between in a Premier League team, anything between 3 plus more physiotherapists, couple of soft tissue, um, and then can be 1 or 2 doctors working within the first team environment. And then, of course, you've got the sports scientists, the strength and conditioning coaches. You can have anything between 10 to 20 people within the department. And so, you know, naturally, you've got to have somebody who's going to be leading that department to make sure that everybody's pulling in the same direction.
Mm. Yeah, was it at that point at Tottenham then that you became full time?
So I'd done 6 months as the academy doc, and then again, another opportunity came up within the first team, and they advertised the role, and they asked if I'd apply for the role, and I always wanted to, make sure it wasn't just handed to me, that I applied for the role, and show that hopefully I was the best candidate possible. And so I applied for the role, and again, must have done something right, because I got offered the role, and so I accepted. I was again, I'd already been working for 6 months with Wayne, enjoyed working with him, and so the opportunity to work alongside him again and the rest of the medical team there was something I just couldn't turn down.
And then who sits on the panel line when you're in an interview? Bearing in mind you're at the club in this instance. Who's on the interview panel?
So you had Wayne, um, who's the head of the whole team, the sporting director, who's Damien Camoli at the time, and I'm trying to remember. I think there might have been somebody from HR as well. So there was at least three people, and it was the same when I had the academy interview as well. So I had the sporting director and the head of academy, John McDermott, at the time, and so they're the ones that interviewed me at the time. So again, they were really asking questions in terms of different scenarios, how I would manage different situations, and what my plans were, and uh, how I could contribute to the department.
Yeah, no, it's interesting. It's interesting. And then, so you go in, that's your full-time role at Tottenham. And how long were you there for?
So I was there till 2010. So we just qualified for Europe in 2010, and so I was coming to the end of my contract, and so it was coming to the point of renegotiating my contract. And as clubs do, they'll always let the contract run down, close to the end before they start having any discussions. And so I was getting a little bit worried at that time as to um, either they weren't going to offer what I was expecting, or they may have other plans. So right at that time, another opportunity arose where there was um, a first team doctor role at Liverpool. And also I was contacted by someone there saying that this role has come up. Would I be interested in applying for it? So I applied for it. And to be honest, my main reason for applying for it was as a backup plan in case Tottenham no longer wanted me. And also hopefully to try and put a little bit of pressure on Tottenham to say, look, I want to stay here at Tottenham. I was based in Enfield, North London, which I still am. I don't want to move anywhere else, but it would be good if I could have a little bit of security regarding my own future. And so I went through the whole process with the guys from Liverpool, through two-stage interview, and they actually offered me the post, which then yeah, made it quite a difficult situation because of the fact before that I hadn't even told my wife that I'd applied to Liverpool. And the main reason for that was in my own head. I was uh, I was confident that I was going to be staying at Tottenham Hotspur. And my main reason for applying for the Liverpool position was to use it as a negotiating tactic at that moment in time, but as a backup plan just in case it wasn't. Um, but the big attraction also was the fact that not only was it Liverpool Football Club, but uh, the head of the department at that time was also going to be Peter Bruckner. And so he'd also sold it to me very well. So I was starting to thinking about it. I was starting to think about it a lot more than I had done. And it got to a stage where the offer that Liverpool were making, and the fact that they really wanted me, sort of persuaded me that actually it's time for a new challenge. And that's when I then had the conversation with the missus, which was quite interesting.
Yeah, how did that go?
Um, well, it was. I think her response was, "Well, obviously you're not going, are you?" And so I think that was her first response. And I said, "Look, at that time, I hadn't got an offer back from Tottenham. So I said, look, I don't know what's happening with Tottenham. They could turn around and say, okay, thank you, but no, thank you. And then I'm stuck. And, I could be left at the end of the year, at the end of the season with no job to go back to. Or alternatively, they could back me into a corner and make me an offer which, I wouldn't be happy with, but because I'd have no alternative then. So, we had three young kids, and I rather naively, so she then eventually said, look, if that's what you want to do, go. But there's not going to be any guarantee that we're going to be moving up. And so because it was the first team doctor and I had Peter Bruckner there as well, I was guaranteed 2 days off a week, because he'd always be there and he was able to cover. So at least I was able to come back 2 days of the week, and sort of made it work. It wasn't ideal, because obviously there's a huge amount of travel that's involved in that. But at the same time, I was also happy that I had Peter Bruckner there. He had my back. He was, very, very supportive. The whole club was very supportive, to be fair. And so, although it was very difficult, I'm not going to lie, it was very difficult being away from family. And as I say, I was probably a little bit naive. I thought in my own head that actually when I move up, it'll be, the job's going to be good, and it'll be, the family will then naturally move up. But unfortunately, as you may have heard, my son unfortunately has got heart issues. And so at the end of the first season, unfortunately, he had a cardiac arrest. And thankfully, my wife was at home, and we got a defib at home, and she managed to resuscitate him. And so I think that's when I realized that it was going to be very difficult to actually move the family up, because she'd got all her support network in London. She used to be a GP herself, and she'd given up her career to allow me to be able to go into sports medicine, because as you know, sports medicine, in terms of, it's not a 9 to 5 job, and there's a lot of unpredictability in terms of the hours that you do. And so, I'm very grateful for her, all the sacrifices that she's made, for me to be able to continue in my career. And so there was no way that I could say, no, you've got to move up. And so again, it was just a case of trying to make it work, while while the family was based in London, and to try and come back whenever I could, to actually see them.
Yeah, that must have been tricky. So where were you living then?
So I was living in Liverpool. And so for the first 4 years, so I was there nearly 5 seasons. So for the first 4 years, I was staying in Liverpool. My parents were in Rochdale, so I was, the plus point was I was able to see them quite regularly. And I spent a lot of time mainly in Manchester. And the main reason for that was that you just couldn't venture out in Liverpool. Um, you'd get recognized quite a lot, and obviously every conversation was what's happening at Liverpool, when's this player coming back. So it used to be quite relentless, and as I say, I'm just a doctor, and I can only, I can't even imagine how difficult it must be for players when they're actually going out. And obviously the fans naturally want to just ask questions and just have a little bit of their time, but it must be even 100 times more difficult for them. So I used to spend a lot of time in Manchester, and I'd have my base in Liverpool, and then as I said, getting into work was easy compared with down south. It was literally a 15-minute commute into work, and so it was good. As I said, the only downside was that the family was 200 miles away.
Yeah, no, I can imagine. And then, so is that what was the main reason for moving on from there then?
Yeah, look, he had another cardiac arrest a few years later. I became the head of the department in the 2012 season, and that's because Peter had decided to join Cricket Australia. So he joined up with them, and so I was asked to become the head of the medical department. And again, as I say, naively, I thought, yeah, once the kid's a little bit older, the missus and the kids will move up. And I think it was really where problems for me really started was in the 2013-14 season. That's the season when we almost won the title, and then after that, Brendan actually pulled me in and said, "Look, I understand that your family is still down south, but this is going to be difficult because now you're going to be in Europe as well. So we qualified for the Champions League. This is going to be difficult, and you really need to make a decision with regards to, bringing your family up here." So again, in my own head, naively, I even bought a house there at the end of the season. I was like, no, I'm going to show the club that I'm serious about moving the family up. I'll get, in the holidays, the family will come up, they'll see that the house is here, and that, this is an opportunity where it can work for all of us. But look, I totally understand. With regards to why my wife couldn't move up to Liverpool, because all the support network was there. And as you rightly pointed out, when we've got away games, when I'm in Europe, she needs to have that support network there. So it would have been really unfair, considering all the sacrifices that she'd made, for me to have expected her to have made further sacrifice to be away from her family and a support network, just so that I can, be close to my family. So that season, the 2015 was very, very difficult, trying to manage both the European games. I remember in December, the whole of December, I didn't have a single day off, and so I wasn't able to go back and see the family. We were in Champions League, we were in the League Cup, and then we got an FA Cup game against Wimbledon, I think it was. And so the next day we had a day off, and I thought, okay, I'll be able to at least go and see the family. And what happened was that after the game, I got a phone call that a player needed to see me back in Liverpool. And I'm like, oh, God. So that call that I had to make to the missus, that after 36 days, I've still not able to come, even though I'm in London, I've got to go back, was quite difficult. And I think that was clearly it wasn't going to work and continue after that. As I said, I had a great time at Liverpool, learned a huge amount, made some fantastic friends, some unbelievable clinicians that I work with, the physiotherapist, the sports scientist, Chris Morgan, Mark Konopinski, Jordan Milson, again, Peter Buckner, Darren Burgess, Phil Coles, all of them, Rob Price. I learned a huge amount from all those people. But at the same time, I've also got to be realistic. I had 3 young kids, and they also needed me as well. And so it was getting difficult, where I was getting torn between the two. So clearly a decision needed to be made.
So how did that culmination come about then?
So I'd spoken with the club and said, look, thanks for the support, but this is going to be very difficult, and not able to continue my current role. So came back to London, and the aim was to go back into, I was going to do sports medicine clinics. So there were lots of clinics that had asked me in the past if I'd come and work with them. So and also the NHS clinics that I had been working in the past. So I had roles to go back into. So as soon as I got back, started doing sports medicine clinics. And then I got contacted, it was actually by Brendan Rodgers, and that Crystal Palace are looking for a doctor, and they've advertised the post, and would I be interested? So at that time, I'm not too sure, because without being arrogant, I was like, well, I've worked at Liverpool, I've worked at Tottenham. I don't know right this moment in time if I want to go to Crystal Palace. And again, that might sound arrogant, but it was more to do with the fact that I was like, there may be quite a lot of work that is required there to bring it to the level where I'd worked previously. But what happened was that I applied for the role, met with Alan Pardew, and he sold it to me. He basically said that, look, he's got big plans, and the owner's got plans for the club, and that I've got a blank canvas, and that really he wants me to help develop and shape the department, and bring it to a standard of the other top Premier League clubs. And to be honest, it's been fantastic. This is my 8th season, and it's been fantastic because of the fact that the chairman, Steve Parish, the sporting director, Damien Comolli, have all been very supportive and have allowed me to shape the department almost from scratch, in terms of, bringing some of the personnel, but more importantly, in terms of how we work as a department, in terms of the equipment. So we've got an operation manual, and again, a lot of credit goes to Chris Morgan and Ed Richmond on that. And what that allowed us to do was, for every single one of our injuries, anything that we managed within the department was all put in there. And so what we did, we all split it up and we looked at what best practice is for each of the individual areas. So whether it be doing a signing medical, whether it be in terms of pre-season screening, or whether it be screening on a daily basis, weekly basis, we looked at amongst us what is the best practice that is out there, and actually put it in there and try to see if it could work for our department. And the big plus point of that was that it then showed the club, but also the owners and agents and players, that look, the methodology that we're using, the practices that we're using, we're trying to look at what best evidence is out there, best practice is out there. So even though this is Crystal Palace, we're trying to provide the same level of care that you could get anywhere across Europe. So that's what really we've tried to implement at Palace. I've been very fortunate that I've had some very young and enthusiastic colleagues who I've been able to share my experiences with, but at the same time, they've also brought a lot of energy in terms of trying to bring new ideas in, whether it be in terms of screening, constantly asking questions in terms of, well, why are we doing this? Why don't we think about doing this? Actually, we're screening, we're doing knee to wall every day, but nobody's actually acting on it, and it's not actually changed our management in the last 2 years. Same with regards to why we're doing groin squeeze every single day, because it's not changed or influenced what we're actually doing. So everything that we're doing, again, goes back to, there's got to be a clear purpose behind it, and that we've got a clear plan of action as from whatever result that we find from whatever we do. So I think if you speak to the people that have actually worked at Palace and that have gone on to other clubs, I think they'd all agree that it really has been a great environment to work in, because we're not afraid to make mistakes. It's an environment where we're not there just to survive. Quite a lot of departments, it's just a case of the clinicians are just there to survive, because they just think that, okay, the next manager is going to come in and it's just a case of keeping your head down. As John Fern, I think when I saw his the interview that you did with him, it's a performance driven environment. We're there to try and get the best in terms of performance, and so you really got to be at the edge of whatever you're doing. It's not just about safety first every single time, so you've got to constantly try and push, because every game matters, every point matters, but at the same time, that doesn't mean that you go hiding and that you're scared that if you make a mistake that you're going to get punished for that. Our thing is always being, look, let's push as long as it's logical, as long as it's making sense, as long as there's open communication and everybody's on the same page with regards to that, then you'll get supported along that. And that's why I think people enjoy working. If somebody goes in and just works in silos and does things in secret, then we do have a problem. And also, if somebody is bad mouthing another person within the department or undermining, certainly in front of players, then again, we'd have a problem. So I've always made it key that whatever happens, we as a team of clinicians together, the department stick together, and we never undermine each other in front of players, because players will always try and look for divisions. And so that's key for us. I'll always be supportive of the staff if they do the right thing. And so, as I say, I've honestly had an amazing 8 years at Crystal Palace. And I'm being very grateful for the opportunity. And as I said, I've been lucky in the sense that being well supported by the chairman and the sporting director. There have been very difficult situations at times where you'll get a new player who comes in and has got a certain way of working, or insists when they get an injury that they're going to go abroad, or they want their own physio coming into the club. And again, the chairman and the sporting director have been quite strong on that, and they said, look, um, Zaf is the head of the department, and we're not going to go against him. So you've got to convince myself. And as I say, I'm open to new ideas, but I've got to think about the whole department and all players, and what is right for the players and the department. And ultimately, it's about making the right decision, not for me, but for the players and the club. And I'd like to think that the people that I work with, they'll often see that.
Yeah, and then so for you then, who do you report to? Is the head of sports medicine? Is it the sporting director directly, or?
Yeah. So I direct the sporting director, but also Steve Parish plays a huge role. He likes to know everything that is going on with regards to players. So on a daily basis, there'll be a message going to the sporting director and the manager in terms of before training and after training. So they've got an idea exactly where players are in terms of availability, or if they've got any issues. And then once a week, I will do a report to the chairman. So every Friday, there's a report that goes to the chairman, which then goes out to the other shareholders. So that gives us a state of play of exactly where players are, uh, more with regards to those that are injured, so that they know week by week exactly where a player is in terms of their injury, whether they're on track, whether there's been any setbacks. And that also allows them, if we need any additional support, then it allows them to jump in as well and say, look, if there is anything else that you guys require, then as opposed to them only finding out, say, a month down the line, and then they turn around and say, well, why didn't you tell us sooner? So it's great that Steve has that, that much interest, because it then just does make it easier when we get a problem, that it's nipped quite early, as opposed to it being much further down the line, and then it becomes a lot more difficult to try and resolve.
Yeah, it must be really interesting because you've got like it's quite a small community, it sounds like there, as opposed to some of the bigger like American owned or Russian owned or whatever. So yeah, no, that sounds really interesting. So does he ask medical questions then of you?
Yeah. Oh yeah. Uh, and I wouldn't expect anything less. You've got to be able to, at the end of the day, the club's assets. So um, you know, always constantly anything in terms of any particular problem. So we've got the other three shareholders are American. So Steve then passes on the information to them as well, and they're always, if there's anything that they don't quite understand with regards to a particular procedure, or if there's a particular problem, they'll all jump in. They're not shy with regards to that, and they'll offer their suggestions as well. So it's also part of my role to actually either confirm that actually we've already explored that option, or why it's not a sensible option in this particular case. And as you can imagine, as all owners, as is the case with all owners, they will get emails and messages from around the world. So whenever a key player gets injured, I'm sure that the chairman, will get several messages from around the world in terms of how, with their treatment, they can bring the player back in a tenth of the time that their own doctor and physio could do. So, and again, the chairman is fantastic. He'll pass on that message, and then I always make sure that I respond. I can never ignore those. I'll always respond back to the chairman, and explain to them in terms of whether there's any evidence or truth with regards to the treatment or methodology that is being proposed. So again, look, because of that open communication, I actually enjoy it, because it keeps me on my toes, constantly learning, as opposed to, suddenly you're finding out that the player has gone away and had a particular treatment. I only find out about it afterwards. and things being done in secret. So I'd like to think that the players and the agent and the sporting director and the chairman know that we're quite open as a department, and that there aren't too many treatments that are being done in secret. And that, again, as I said, there are treatments which I wouldn't necessarily, when I first started out, would have agreed with, but I've come round to understanding, and that there is a place for, quite a lot of the different treatments. There are some treatments which I make it quite clear that, look, there's going to be more harm than good done as a result. But there are some treatments where I think, actually, even though there may not be great evidence for it, as long as it's not doing harm, and if the player feels that it's going to do benefit, then it's far better that I comply and be cooperative with that. And so, for example, I learned how to do trauma healing, active vegan injections, prolotherapy, PRP, and you'll have some advocates of it saying that PRP is the it'll cure everything, and there's huge amount of evidence for it. And as I say, the evidence behind it, if you actually look at it, is not a huge amount. um, but at the same time, I also understand that there is a role for it, and in certain conditions, I will use it, because physiologically it does make sense to me, especially if I want somebody to be immobile for a while. So, for example, if it's a particular long-term tendon injury or a ligament injury, then I may consider prolotherapy or PRP, especially if I want that particular player to be immobile for a while. So it can help, in my mind, with regards to that.
Yeah. Yeah, no, it's really interesting, the dynamic of how it all comes together. And then I know you do a lot of work outside of football, and you mentioned about like the defib that your son uses, and I know you're involved in the integration of that. But how did that come about?
So it's when I was in Liverpool, there was I came across the Oliver King Foundation. So there's a gentleman called Mark King, whose son Oliver King unfortunately passed away when he was 12 years old while swimming at school. And so they, his son and Mark, both hardcore Everton fans. And I just came across a newspaper article on it. And so his father was raising money to get defibs in all schools in around Liverpool. And so I got in contact with them. And so together we just started raising more awareness, and they've done fantastic work. And so what their aim was to try and make it mandatory for all schools in the UK to have a defibrillator. So they set about having a petition, and I just literally called upon footballers and other sports personalities that I knew to raise awareness regarding the petition. And within a couple of weeks, we managed to get 100,000 signatures. So it went to Parliament, and they just stopped short of making it legislation. But thankfully, they kept pushing. I've been constantly trying to raise awareness where I can, regarding the importance of having a defib nearby. And last year, the government has finally agreed that all schools, as of 2023, should have a defib on site. So that's been fantastic work by the Oliver King Foundation and many other foundations on that. And the next thing is really we're trying to push is to try and have every school leaver, or as many people as possible, to learn how to do CPR, and also recognize the importance of knowing where their nearest defib is, and how to use that. So that obviously came about from what happened with my own family, and seeing how important that was. Uh, but I feel there's lots of people that have helped me along the way in sports medicine. And as I said, my dad from a young age has always taught me the importance of doing as much as you can, making a difference to other people's lives. So I feel it's my way of giving back. And so I find it personally quite rewarding when I'm able to help others in their own lives. Similarly, I do quite a lot of mentoring other doctors where I can, in terms of sports medicine, who want to follow down similar pathway, and then also educating doctors and physios, so trying to quite a bit of lecturing when I can. And then also other countries where sports medicine isn't as well established as it is now in the UK. I'll get contacted by athletes from other countries who may not necessarily have the same setup as we have here, and where I can. So whenever I get a spare moment like this, when I'm at the hotel, I'll just do Zoom consultations with them and see if I can try and help them. And on the odd occasion, there have been athletes that have come to the UK, and we've been able to help them at Crystal Palace. Again, the chairman's fantastic. So last year we had Shaheen Afridi and Fakhar Zaman, who are two key cricketers for the Pakistan cricket team. So before the World Cup, they both got injuries, and they were struggling to actually make it for the squad. And the chairman and the manager both were completely okay with the players coming and using our facilities for 6 weeks, which, as I say, I found personally quite rewarding, and the players were really grateful for that, and the staff enjoy it as well. So it's a different sport as well, and it's always interesting to see, even though they're meant to be elite athletes, the care that they get is unfortunately in a lot of these countries is a lot less than what we're able to provide here. And so our own staff enjoy the fact that the base at which they're starting from, in terms of from a strength and conditioning and movement perspective, is a lot less than what you'd expect, a professional athlete here. So we all find it quite rewarding in terms of being able to help others from other countries as well.
Yeah, no, that's great. Really good initiative. And I also saw that you've done some ringside medical work in boxing.
Yeah, I did that more in Liverpool, and I've only had time to do a couple of fights down here. And again, the main reason for that was I was always interested in terms of how the cut man was able to stop bleeding quite quickly. So when the boxers actually had, when they had the cuts across the forehead and stuff, in terms of how they're able to stop that with the adrenaline and the Vaseline and putting the iron on. So I initially wanted to try and find out a little bit more about that, and also improve my um, suturing skills as well, because obviously those guys would get lots of cuts and stuff. So it was another opportunity to be able to do that. And while I was in Liverpool, because I'd have quite a lot of evenings off, and most of the fights were in the evenings, it just meant that it was another opportunity for me to upskill myself and keep myself active.
Yeah, well, I thought it might come about from having worked with the Hearns at Leyton Orient. Was that an overlap at that point?
No, so I hadn't started at that time. So although I had seen a couple of boxes, but that was for other issues, in terms of they'd be brought in, um, and so they were all under the Matchroom umbrella. So I would, on match day, I would occasionally see a boxer after the game with either a shoulder problem or a back problem, and so would give them my advice. But I hadn't specifically gone into boxing at that time. It was really only when I gone to Liverpool and had a little bit more time to myself, that's when I started doing a couple more events.
Right. Oh, interesting. Oh, Zaf, I really appreciate your time today, especially on a match day. So I'll let you get back to the prep beforehand. But thank you for sharing your stories. Really interesting, and good luck with the rest of the season.
Cheers. Thanks again, Andy, for having me. Thank you.
No problem.